My name is Melissa Reed, and my presentation is on neurofibromatosis type 1. 1 in 3,000 people are born with neurofibromatosis type 1 each year. Neurofibromatosis type 1 is commonly referred to as NF1. It's a multi-system genetic disorder which is caused by a mutation of the NF1 gene located on the 17th chromosome. This mutation can happen spontaneously or it can be inherited. It's a complex autosomal dominant disorder. So if one parent has NF1, there is a 50-50 chance their offspring will be born with the disorder. And the severity of the disorder in the parent does not predict the severity in the offspring. The signs and symptoms of NF include cafe au lait spots, neurofibromas, freckling in the armpit and groin regions, Lisch nodules, optic gliomas, bone deformities, learning disabilities, larger than average head size, and a shorter stature. So cafe au lait spots are pigmented macules that resemble birthmarks, and it's very, very common in NF1. They are not pathological. Other disorders have cafe au lait spots as well, and they are generally one of the first clinical manifestations of this disorder. Neurofibromas are soft, benign tumors that develop on or under the skin. They develop on nerve endings and can also grow inside your body. Neurofibromas include plexiform neurofibromas when a growth involves many nerves. They're also a cause for disfigurement, especially when they are located on the face, as you can see in the photo of the woman with the plexiform tumors on her face. The number of neurofibromas generally increase with age. Freckling in the armpit and groin regions is very, very common. It usually manifests between the ages of 3 and 5. Lisch nodules are specific to NF1. They were first described in medical texts in 1918, and a slit lamp examination is usually required to officially diagnose them. They are dome-shaped elevations that project from the surface of the iris. Optic gliomas are also possible with NF1. It is the most common CNS tumor in NF1. They're slow-growing tumors which usually present in childhood. Malignant gliomas are rare, but when they do occur, have a very, very poor prognosis. Bone deformities. Bone deformities are a hallmark common sign of NF1. Scoliosis is also very common in NF1, and bowing of the lower leg, which usually involves the tibia. Neurofibromas also can grow inside the bone, causing fractures as the tumor grows in the bone. Learning disabilities are also very common. Learning disability is like a shortcut in one or several channels of the brain. So as a result, there can be reading, writing, math, memory, and focus difficulties. ADHD is also very common in NF1. The processing information in the brain becomes disordered. So it is also very common for people to misunderstand social cues and body language. Shorter stature, larger head size is also common with this disorder. They do believe that the larger head size occurs due to increased brain volume. So the etiology of neurofibromatosis type 1, it is a syndrome with neurological and cutaneous manifestations. It causes benign tumors on the nerves. NF1 manifests at birth or during early childhood. It's caused by mutations of the NF1 gene, the gene that controls the production of a protein called neurofibromin. The gene functions as a tumor suppressor. 50% of cases of NF1 occur spontaneously, while the other 50% are inherited. The genetic inheritance is as follows for NF1. It's an autosomal dominant disorder. The mutated gene is a dominant gene located on one of the non-sex chromosomes. Genetic testing for NF1 can be done, but it cannot predict the severity or specific complications of NF1. NF1 affects all populations equally. 120 people are born with NF1 each day. It manifests very differently from patient to patient, ranging from very mild to very severe, and chances are you know someone with NF1 and may not even realize. 60% of diagnosed NF1 cases are considered mild, and many people have NF1 and they are not even aware of it because they do not display very many symptoms. The diagnostic criteria for NF1. Patients must exhibit 2 or more of the following. So you must have 6 or more cafe au lait macules, freckling in the groin or armpit area, 2 or more neurofibroma tumors of any type, or at least 1 plexiform neurofibroma, 2 or more Lisch nodules, optic pathway glioma, bony lesions, a positive NF1 result on genetic testing, or a parent that has NF1 based on the criteria listed above. There are many complications of NF1. They can include neurological problems, which include a buildup of the fluid in the brain and can cause epilepsy, concerns with your appearance. So neurofibromas in the facial area causes anxiety and emotional distress in patients as they're disfigured, skeletal problems, vision problems, cardiovascular problems. So high blood pressure is very common with NF1 as well, breathing problems due to neurofibromas, cancer. 3 to 5 patients can develop cancerous tumors or a benign adrenal gland tumor. The treatment options, there is no cure for NF1 and most likely never will be. The treatments are limited to treating the signs and symptoms as they occur. This can include surgery, stereotactic radiosurgery, auditory brainstem implants, cochlear implants if the hearing is affected, and medications such as pain management medication, drugs for nerve pain, tricyclic antidepressants, SSRIs, and epilepsy medications. And currently research is being done testing for gene therapies for NF1. Their goal is to replace the NF1 gene to restore the function of neurofibromin. As listed, here are my resources, and I hope that I have shed a little bit of information on NF type 1, which is one of the most common genetic disorders in the world. Thank you.